To continue, I am an investigation discovery fan, and one of my favorite shows is Disappeared. And after investigators dig into a person's life and talk to family members and friends, they discover that that person was at high risk for suicide. And the family members and friends keep saying, well, that's not possible. They seemed all right. The last time I saw them, they were happy. They didn't leave a note. Well, suicidal people don't always do that. They're very good at masking their pain. They don't always share their intent. And it leaves that family traumatized because they don't, most of the time, get closure for that special family member and friend. They never find out what really happens because most of the time investigators, their leads go cold and they never find the person, or they find their remains, and that family is left traumatized for the rest of their life. It is sad but true. These things really do exist. And it doesn't matter if you're a Christian or not. It can happen to anyone. You might say, well, Christians don't commit suicide. Well, my theory is that many people, they start out in salvation and they live for the Lord and they love the Lord, but they let the problems of this life choke out the word. They lost their faith and they feel that suicide is the only answer. It really is a selfish act, because not only are you hurting yourself, you're hurting those that love you. They're going to be left scarred and traumatized for the rest of their life, many people. Some people do heal and they're able to move on, but many people don't. So I'm saying to you that life is hard and we all have our crosses to bear. But when we get to that point, when we start thinking and contemplating suicide, get help right away. You're at high risk and you need intervention. You need help. Your life is precious. It means a lot. You might can't see that right now because you're so focused on your problem. But that's what we have to learn, how to breathe, close our eyes, and really, really regroup. We have to deal with one problem at a time. And the Lord will show you how to do it. He can use books. He can use counselors, medical health professionals, treatment, medication, whatever it is. The Lord will do all that He can to help you. But you have to want the help. You have to admit to yourself that you made a mistake. You have to admit that you need help and that it's all right to make a mistake. We're not perfect. And that is a misconception that many Christians have, that I can't talk about this. People are going to be humiliating me and I'm going to hit a wall. I'm too ashamed, and it's the guilt that keeps you locked in a vice grip of fear. And it gets to the point you can't think straight. Your breathing and your heart rate increases. You're not sleeping. You're not eating. You're isolating and withdrawing from people, which is a very dangerous thing to do. As I mentioned before, we all need accountability. We all need some help, someone we could really trust to talk to help us make it through this crisis that we may be experiencing. We remember the promises of God that He promised He would deliver us out of all of our trials. But when you are suicidal, all of that stuff goes out the window. We lose our faith. Excuse me. And we take our eyes off the prize. We forgot to keep looking forward to the mark of the prize, which is Jesus Christ. That's our ultimate goal. We get to focus on our problems, and we just got to step back, regroup, and deal with one problem at a time. And little by little, as we learn to do that, our problems, we can find the solutions to our problems. But when you're highly stressed and your stress hormones are working overtime, and you're hyperventilating and depressed and anxious, we can't really think straight. So we just got to learn to breathe, close our eyes, seek the Lord, spend that quiet time, and ask the Lord, what is it you need to do in whatever situation you're facing, and He'll direct your paths. He will do it. We just got to trust Him. And I know that can be very difficult for some of us to trust, but the Lord is our anchor. He's all that we have. That's eternal. He's all that we can rely on. He's the only thing that is eternal. Everything else is temporary. So if that is true, what you're going through is only temporary. It's not going to last forever. We just gotta just take it easy. We may have to train ourselves to do that, and that's what counselors do. They help people to cope. They teach them coping skills and strategies to be able to think straight and really make right decisions. And of course, we don't do the work for you, but we're there to assist you. And we want to help you. But you have to want the help. You have to reach out and get help. You need to make a commitment to change. That's the first part of your healing process. Making a commitment and staying in the game until that crisis is over. God gave us life to live for Him, and it is wrong for us to take our own life because times are hard. He didn't promise us that everything was going to be perfect. He suffered for us. He was our model. So we just have to depend on Him and other people to assist us when we need help. I'm going to talk about suicide triggers. Theories and thoughts on suicide have changed over the years in the psychological and the general population. Changes seem to reflect trends in religious beliefs, pop culture, academics, and more specifically research into this subject. However, despite the increase in information available, suicide is still a very misunderstood and confusing topic. Different cultures and individuals view the act of suicide in a different way. Similarly, there are a number of different factors that can drive one to commit suicide. These different factors are called triggers and reflect different segments of the population that are at risk for suicidal behavior. 1, there is high stress levels that affect both your mental and physical health. The dangers of high stress go beyond simple impairment of mental functioning. There's increased forgetfulness, absent-mindedness, lack of concentration. High stress can lead to suicidal thinking and attempts. Two types of stress in particular increases one's risk of suicidal behavior. The first is immediate stress, and the second is long-term stress. Immediate stress deals with the sudden onset of high stress. While some people are apt to handle the sudden increase in a healthy manner, others turn to suicide as an answer to their grief. I use the word grief because sudden onset of intense stress is generally due to the loss of a loved one, divorce, rejection, disaster, or other things similar in nature. Long-term stress is moderately high to high levels of stress experienced over a long period of time. Common in this group are individuals with long-term or chronic illnesses that taxes you psychologically and physically. Individuals in abusive environments, prison inmates, abusive relationships, child abuse victims, and those prone to high stress at the workplace. The second triggers are related to changes in moods or thoughts. As Schneidman wrote back in 2007, the key to suicide is the psychashe. It's a feeling of psychological pain that's intolerable to the person. Along with that thought comes changes in your thought patterns, such as you're so preoccupied with your problems that you don't have the ability to see a solution to your problem. You lost perspective of life. In fact, one of the most serious indicators of suicidal thoughts or intentions is the feeling of hopelessness. As the psychologist Cormier wrote back in 2005, individuals experiencing hopelessness or increased sadness, stress, anxiety, and the like can turn to a change in thought called dichotomous thinking. Dichotomous thinking is the type of thinking in which there's only one solution. Either I kill myself or this pain will continue. Suicide is my only way out. There are also emotional triggers. Excuse me. You may be thinking that feelings of hopelessness, anxiety, anger, sadness, frustration seems to signal you have a mental disorder, but that isn't always the case. Many individuals may have these problems, but they don't have a DSM-4 mental disorder, or they don't display a significant enough shift to be detected or diagnosed. However, there is a striking number of mentally disabled or disordered individuals who do commit suicide. There are also mental health disorders that come into play. Individuals diagnosed with severe depression, chronic alcoholism, and schizophrenia make up a significant portion of the suicidal population. 15% of people with these disorders attempt suicide, according to Cormier back in 2005. Drug and or alcohol can influence one's intent towards suicide by stifling them. However, the individual most likely has contemplated suicide before that point. Studies show that around 60% of suicidal individuals drink alcohol right before the act. I'm going to talk about the risk factors and warning signs for suicide. According to the AFSP, the American Foundation for Suicide Prevention, the most frequent risk factors for suicide are mental health disorders, depression or bipolar manic depressive disorder, alcohol, substance abuse or dependence, schizophrenia, borderline or antisocial personality disorder, conduct disorder in youth, psychotic disorders, psychotic symptoms in the context of any disorder, anxiety disorders, impulsivity and aggression, previous suicide attempts, family history of attempted or contemplated suicide, and serious medical conditions and pain. It's important to bear in mind that a large majority of people with mental disorders or other suicide risk factors don't always engage in suicidal behavior. But that is why counselors come into play, because you might have severe depression, you're suicidal, but there are other things underlying depression that you may not be aware of. You may have a mental health condition that could be genetic. It could be caused by a, I don't want to say disorder, but a chemical imbalance in the brain. These things you wouldn't know unless you go and get some help. And a lot of us do struggle with those disorders, but we're too ashamed to talk about or go get help. And we wrestle with them constantly, and it's ruining our life because we don't want to take the time to go get help. We might think if we go get help, people think I'm crazy, I'm not a Christian. Well, that's not true. That just is not true. I have to be strong in the Lord. Yes, you do have to be strong in the Lord, but it's not by our power or might. It is by the Spirit of the Lord that we are strong in the Lord. So if you're having these problems, you need to go and deal with it right away. Some of us as Christians, like I said, we're good at masking the pain, and we've been dealing with this for many years, but we still serve in ministries, and we're in the hospitality ministry. We're greeting people at the door. We get to the point where we're just doing things for the Lord religiously. I can't stop because then people know my secret. Those are things I like to call my dirty little secrets. Things about us that we don't want people to know. Well, that's where counselors come in. You could go and talk to them confidentially, and because of the American Psychology Association that runs the counseling industry, we have a moral conduct with the APA, which means that we cannot share what you tell us with other co-workers or family members without consent. We have a standard of code and conduct, moral conduct that we have to follow, or we could lose our job. So we can't just share your business. You could be confident that what you tell us will be very confidential. There are exceptions where things you share with us have to be shared with other people, such as the court system, if it's like child abuse or something like that. Hospitals, social workers, teachers, they're mandated to report abuse and things like that. We as counselors are mandated to report abuse, but overall, we're someone you can trust not to share what you tell us with your friends, your family, or other people you don't want to know about your business. So that spirit of pride, we have to put that aside and go get the help that we need so we can heal and be delivered and be effective in our calling and election. Protective factors for suicide are characteristics or conditions that may help to decrease a person's suicide risk. While these do not eliminate the possibility of suicide, especially in someone with risk factors, they do help reduce risk. Protective factors for suicide have not been studied thoroughly as risk factors, so less is known about them. The protective factors for suicide include receiving effective mental health care, positive connections with family, peers, community, and social institutions, such as marriage and religion, that foster resilience, learning the skills and ability to solve problems. Protective factors may reduce suicide risk by helping people cope with negative life events, even when those events continue over a long period of time. The ability to cope or solve problems reduces the chance that a person will become overwhelmed, depressed, or anxious. Protective factors do not entirely remove risk. However, especially when there is a personal or family history of depression or other mental health disorders, protective factors is a very important part of healing and reducing the risk that a person will take their own life. And again, that is where counselors come in to help and assess whether that person does have any mental health disorders, that they do need mental health care, and even teaching people coping skills to be able to solve problems one at a time. Most of the people who do kill themselves showed one or more of these warning signs before they take action. They talk about wanting to kill themselves or say they wish they were dead. They look for ways to kill themselves. They talk about a specific suicide plan. They feel hopeless or have no reason to live. They feel trapped, desperate, a need to escape an intolerable situation. They have the feeling of being a burden to others. They feel humiliated, having intense anxiety and or panic attacks, losing interest in things or losing the ability to sense any type of pleasure. They don't sleep well at night. They have insomnia. They're socially isolated and withdrawn from friends, family, and other people. They act irritable or agitated. They show rage or talk about seeking revenge for being victimized or rejected, whether or not the situation to that person seems real. Individuals, including pastors, who show such behaviors should be evaluated for possible suicide risk by a medical doctor or mental health professional. In conclusion, what can we do when we suspect someone may be at risk for suicide? First, take it very serious. 50 to 75% of all people who attempt suicide told someone their intention. If someone you know shows the warning signs that I mentioned, the time to act is now. You can ask questions. Begin by telling a suicidal person your concern. Tell them that something that they said specifically or done makes you feel concerned that they're going to commit suicide. Don't be afraid to ask the person whether or not they're considering suicide and whether they have a plan or method in mind. These questions will not push a person to commit suicide if they were not already considering it. Ask them if they're seeing a doctor or taking medication so the treating doctor can be contacted. Do not try to argue someone out of suicide. Instead, let the person know that you care, that they're not alone, and they can get help. Avoid pleading and preaching to them with statements like, "You have so much to live for. Your suicide will hurt your family." They're already wrestling with guilt, and when we make comments or even preach the word to them at that point, we're adding more guilt to the pain that they're already feeling. Encourage professional help. Actively engage and encourage the person to see a physician or mental health professional immediately. People considering suicide believe in their minds that they can't be helped, and that's why they hide behind that spirit of pride, because they feel no one can help with their problems. I'll do it myself. I don't need your help. I don't need God. But if you can assist them to find a professional and schedule an appointment, and if they would allow you to, you could go to the appointment with them. Next, take action. If the person is threatening, talking about, or making a specific plan for suicide, this is a crisis that requires immediate attention. Never ever leave the person alone in that condition. Remove any firearms, drugs, or sharp objects that could be used for suicide. Take the person to a walk-in clinic, psychiatric hospital, or hospital emergency room. If you're not able to take the person there, then call 911 or the National Suicide Prevention Lifeline at 1-800-273-TALK. That's 1-800-273-8255 for assistance. Next, follow up on treatment. Still skeptical that person can be helped, the suicidal person may need your support to continue with treatment after the first session. If medication is prescribed, support the person to take it exactly as prescribed. Be aware of possible side effects and notify the person who prescribed the medicine if the suicidal person seems to be getting worse or resists taking the medicine. That's where the doctor could come in and adjust the medications or dosage to work better for them. Help the person understand it's going to take time to find the right medication and therapist. Offer encouragement throughout the process until the suicidal crisis has passed. On a final note, I want you to understand the person who is suicidal, or if you know someone who is suicidal, know that Christ is our anchor, and we must hold on to his promises and soak up the word of God daily to strengthen our minds and spirits. We must always go to God with our shortcomings, failures, and sins so that we can receive forgiveness and know that it's not him that condemns us, it's often we ourselves.